So orthodontics, you're saying that you are trained in orthodontics, but with kids that have bedwetting problems, ADHD, nightmares, restless sleep, they wake up with dark circles, that in certain cases, orthodontics can open up their airway, get them sleeping again, because you say maybe they're not sleeping. So tell me.
So if we get to what the root cause is, and that is there's not enough room in the mouth.
Okay.
The tongue has to fit somewhere. So if the jaws are small, the tongue's going to go in the back of the throat. So as a consequence, these kids aren't breathing. So we see the children coming in with all these symptoms: ADD, ADHD, hyperactivity, poor social skills, struggling in school, bedwetting, and we see this over and over again, and we see this corrected without even needing to go into what we would call standard orthodontics, which is braces.
Okay.
So by expanding their arches.
So you're using what, like
it's a removable appliance, somewhat similar to like
an Invisalign kind of a thing?
Yeah, it's actually probably more like almost like a mouth guard, like a football guard. Okay, but they're made specifically to help guide the teeth into the right position.
So they move the teeth.
They actually grow the jaws and allow the teeth to fit in. So now the teeth fit into the arch. So not only are we seeing these symptoms go away, the ADD, ADHD, hyperactivity, but also these children, when they're 12 years old, they don't need braces.
Nice.
It's a great benefit. So the parents are thrilled to death. So we can treat the health issues and also prevent the orthodontic needs for the future.
Okay, so when they go to see you, somebody takes their child that has, and I'm looking at the cover of your pamphlet here, nightmares, teeth grinding, bedwetting, difficulty in school, ADD, ADHD. If they have these problems, you do an evaluation. Some kids you could just treat with an appliance to open their airway.
Yes.
And they're sleeping and they get great results. Or some people may need ortho. Is that right? Like a type of orthodontics.
Yeah, some of them might need orthodontics, but the majority of them, now, let me make it clear, our first concern is their health issues that we talked about, those symptoms. Those are much more important. I mean, if they need orthodontics, that's a different story, but that's kind of a side benefit. I mean, think about, now we've made healthier children, but also they don't need to go into that 2 years of braces. I mean, of course, now with Invisalign, it's a lot easier, but also we're not extracting teeth. Because here's what happens in traditional orthodontics, and I'm a victim of that, okay? I had 4 teeth taken out. I had everything retracted backwards because they had to close the spaces. And as a consequence, I had no room for my tongue. So now my tongue sits in the back of the throat. I'm not breathing. I'm not sleeping. I start to have a lot of fatigue. So here I am treating these things and saying, wow, I'm actually a victim of this problem.
And you were snoring. You were a snorer.
Yep.
And you're a thin guy.
Yeah.
You're lean.
No one would think I was a sleep apnea patient. Right?
And so
I'm not your typical overweight, obese.
So you didn't need orthodontics?
Probably not. Not if this treatment was available. Now,
back then?
Yes. So in the 1960s and 70s, I didn't know about it. Of course, my parents didn't know about it, but now it's available. So it's very possible that I would never have needed 4 teeth extracted or to go into braces.
You know, it is hard to believe that you've had patients that bring in their child and their ADHD goes away.
Yes.
ADD goes away. Yeah. Bedwetting goes away. Really?
Yeah.
Because their kids were not sleeping.
They're not breathing, actually.
Okay, they're not breathing and sleeping.
Yeah.
But they appear to be sleeping.
They appear to be sleeping.
But they're waking up, and you identify this on a sleep test.
Yeah. So we can see it. I mean, if a parent wants to sit in there and observe their child all night, they'll see the child's restless, or you can look at the covers in the morning. You see the blankets all over the place, and maybe they have drool on their pillow. You can hear them grinding their teeth. All these things are symptoms. They're not benign.
So when you fix those and get your child back to sleep, the kids are waking up in a good mood again.
It's miraculous. It's so simple, but it's not.
Okay.
It's simple in terms of...
This is a big topic, and I'm like kind of rushing you here, because your book, Stop the Snore, lots of stuff in here for kids. Parents should read this book.
Yes.
And adults
Definitely.
should read the book.
Yeah. It's a paradigm. We got to just open our mind, be a little more open to possibilities.